Life on Sherbourne Street was comfortable. We were good at what we did. Latterly, a major focus of attention was the relocation, or more specifically, the new building, its location, and its capacity for care and treatment. However, the real challenges were not relocation per se, but rather the evolving changes in policy, funding, and healthcare practice.
Perhaps most dramatic would be the view of the day was that we do acute cancer care. Now we do from public education to prevention, right through all aspects of care to palliative care and hospice care. That was considered not our job in those days. Now we lead the world in those areas.
20 years is a long time and a lot has happened. I think a couple of things. The first would be the amount of research that's being done in the organization, and I'm talking about Princess Margaret and also sort of coming together with the whole organization. So that's a very big change. Secondly, probably the amount of fundraising money that has been put forward and supported programs of Princess Margaret. And I think the other thing is that it has become a comprehensive cancer center because in coming to University Avenue and in becoming part of UHN, it actually added a very large surgical component, which it didn't have before.
I think to understand what's really special about Princess Margaret over the last 20 years is to look at the different services that we're able to offer patients from when we were on Sherbourne Street to the new location on University Avenue. I think the biggest change has been the development of a comprehensive cancer program for patients. So if we look where we were on Sherbourne Street, we had excellent radiation services, malignant hematology services, chemotherapy, but really surgery was only there in consultancy. It wasn't there providing actual surgical care. Within a comprehensive cancer program, I think our medical imaging services were very limited. And of course, we had very few pathologists and folks on the diagnostic side. So I think as we moved to University Avenue and became part of UHN, we were able to offer our patients such a dramatically increased breadth of comprehensive cancer service.
I do remember the move in '95. I was part of the move. At the time, we were over at 500 Sherbourne in a small little hospital, and to move over here was like moving into a mansion. The rooms were big. We had lots of supply room, bigger nursing stations for us to work from. Everything was just big. What really inspired us was the fact that we would be working with Toronto General on one hand and Toronto Western on the other, and that we would have available to us instant help. If we needed a cardiologist, they were there. If we needed an orthopedic, it was just pick up the phone. Before, we had to wait till they could come along to Sherbourne Street, and sometimes it took days.